Hi, I'm Haley, and I'm going to be doing my case study project on cystic fibrosis. For those of you that don't know what cystic fibrosis is, it's a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. So basically, like the constant damage through the years of having this disease is irreversible, which basically is deteriorating your lungs over like all of the years that you suffer from this disease. It mostly affects the lungs, but it affects other organs like your pancreas mostly too. Your intestines, your small intestine, um, your kidney, your liver. It could, but basically, the main organ is the lungs. And what happens is the mucus starts to build up and create a blockage from all of the mucus building up. So you're it's harder for people that are suffering with this disease to breathe, and with all the damage that goes on and on and on, it just increases, the difficulty just increases over time. And basically how you categorize the disease would be mild, moderate, or severe. Severe obviously being the worst, but even when you have mild cystic fibrosis, it still obstructs you from going and doing every single thing that you'd want to do. If you want to exercise or go do anything that requires a lot of aerobic activity. For the diagnosis and the genetics of cystic fibrosis, so basically how you get the disease is both parents carry this recessive gene, the CF gene, and that's the only way that you can get it if both parents carry it. So if one parent carries it, you can just be a carrier of the disease as well. But if only one parent carries it as well, you can it can skip over you and you don't even have the gene to pass on. But something like the statistics right here, so if this is for both your parents carrying the gene, 1 out of 4 usually get diagnosed with cystic fibrosis, and then half of them will be carriers but don't have it, and then the other 25% would not be a carrier or not have the disease at all. And this actually is a true case. My roommate's 1 of 4, and her one brother has cystic fibrosis. So these stats are pretty true. And more than 30,000 people in the United States alone just live with cystic fibrosis every day. Some common signs and symptoms, not a lot of weight gain, actually a lot of weight loss if you're doing well and you just, this disease starts to decrease over time. Pancreatitis is the inflammation of the pancreas. Like I said, it really affects the lungs and the pancreas a lot. Wheezing, persistent coughing, greasy stool, salty tasting skin, and for males, a lot of the time they become infertile. So a main deficiency that CF can bring is a pancreatic enzyme deficiency, and this is where the pancreatitis comes in play. This happens because the mucus in your pancreas is really thick, and that stops the enzyme from being able to enter the small intestine to break down and absorb the nutrients that you need. And basically these enzymes are breaking down the food, and when you lack them, you actually have to pass partially digested food, and that's where all of the inflammation can come from, and the inability to absorb the nutrients. And then you can even see down here how mucus basically takes over probably an eighth of each air sac, and that's a lot. And you can see the mucus blocking the pancreas down there too. Okay, and here's a picture of normal lungs versus lungs with CF. Obviously normal is a thin layer of normal mucus, the normal thin layer, no obstructive mucus or anything like that. But then this is the lung with CF, and you can see like the walls are thicker, all the mucus is like blocked up and like really, really thick, and that's why it's like really hard for them to breathe and everything. And you can even see like through an x-ray right here. So like the normal lungs look all good like through the rib cage, and then you can see like all of the stuff that's in there blocking and like almost like pushing like on the lungs too. Like it really makes like your chest like hard to like breathe. And then you can even see like this is probably a very severe case of CF, but you can just get the gist of it. And then I have a video to show you about the progression of of CF, and basically it just tells you how, like, it shows you how the progression worsens over time. Like I said earlier about like how like the irreversible lung damage is like the main reason of why CF is so bad.
Cystic fibrosis, or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called a bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath.
And we talked about all that basically. Okay, so that was just a quick video of the progression of how CF pretty much works. Okay, and then now we're going to talk about how to test the lung capacity for people with CF. And I actually read that they do this every year for people that keep up with everything. For people that have cystic fibrosis, they do all these tests like once a year just to see the decline or if it was a steady year and any increase, improvement, whatever. So there's spirometry tests, FEV1 test, and diffusion capacity test. The spirometry test and the FEV1, honestly, all of them, it's just like that device where you just blow like one like fast like breath, and then it can measure your lung capacity, vital lung capacity. You can see if the disease is restrictive or obstructive, and in this case, cystic fibrosis is an obstructive lung disease, and that's basically because the mucus like obstructs the air from getting like through like the pathways and stuff. Okay, and the effects of exercise actually on CF, I mostly found them to be positive. They definitely always have to get their medical professionals okay before performing any tests, because that's just unsafe for them. And so regular physical activity has shown to positively affect these people. It helps them become more functional, more manageable with the disease. Like if they're more like aerobically fit, like we know that helps like your total lung capacity too. It can, and just like help you breathe better. And yeah. So oh, and one more thing about the exercise is that mostly you want to like focus on large muscle groups. So running, walking, jogging, swimming would all be good exercises for CF patients. And so management and medication, I found like the two basic medicines that these patients take every day are mucus thinners and antibiotics. And the two mucus thinners I found were hypertonic saline and DNase or Dornase alpha. They're both inhaled with a nebulizer, and the hypertonic solution, the saline solution, increases the amount of sodium, which actually thins the mucus because of the water being able to come in from the salt's attraction. And what DNase does is basically it breaks the mucus up and like thins it out that way by like breaking up and like cutting it and thinning the mucus. And then antibiotics basically mostly for like the lung infections that they get all the time. The most common for antibiotics are right here. There are staph, penicillin, sulfa, and yeah. So here's some more facts that I found interesting. The life expectancy actually increased like so much in the past 2 decades from like all the findings, the new advancements, and better understanding of the disease. Basically, like they didn't even find like the CF gene until right before 1990. So it's really only been like about 20, almost 30 years since they found like that CF like had a gene. And that was like the reason why people were getting CF. So you can see like down here, like throughout the years, like what they've discovered, and this is like the age. So basically, life expectancy is like 35 to 40 years old now, which is way better than 1955. Okay, and then my case study. So I had a 22-year-old male, sedentary smoker, diagnosed with mild form of CF, good blood pressure, weight and height, they're decent, LDL, HDL, RFG, all okay, fully functioning, does not get tired easily, so I made it so that he could exercise. So I ruled him 3 risk factors, and I said it was because of the sedentary CF, smoker, and yeah, that's what I used. And then I put him in the moderate risk group, and so his goal is to become more aerobically fit and just stronger for upper body everyday activities. And obviously his special consideration is CF, but we wouldn't need to make any modifications unless he was on a different kind of medicine. So for the exercise testing, I had him do an incremental CPE test, CPET, which is a cardiopulmonary exercise test, and you would just use a ramp protocol, do a treadmill test or a bike ergometer test to be able to find the results about like VO2 max, breath by breath gas analysis for CF patients and other factors, do for about 20 minutes. These tests are. And then I said for a cheaper test, you could perform a 6-minute walk test, YMCA, to find all that stuff. And I said, if I were to do this, I would make my patient have a 26% of VO2 max and normal heart rate for after that time. But the VO2 is obviously pretty low, but it's actually pretty decent for a patient with CF. But I did end up saying aerobic activity, 30 to 40 minutes a day, swimming, walking, speed walking, jogging, like what I said earlier, at least 3 times a week, can do on days with lifting. And I put the muscular strength on the days with the aerobic activity as well. It doesn't really matter, I don't think. And I put 3 sets of 8 reps, so he can gain like that strength. And like obviously he could go up if he could from this percentage of the 1 RM. It just depends on the severity of the disease and if it declines, if he gets tired, all that stuff. And I said he could do bicep curls, bench press, hammer curls, rows, anything to do with like the upper body. Obviously he would be getting some lower body workouts too with the aerobic activity. But and then I just said just stretch basically everything. My special considerations were if the subject was short of breath, dizzy, dehydrated, really fatigued, or any new medication, needs to see a doctor to either like stop or we'd have to reevaluate the exercise prescription. And so, overall, I hope that everyone realizes that this is something that needs to be taken into consideration with exercise, especially. And yeah, that's it. Thanks.